there is an increase in the number of males seeking rhinoplasty surgery, partly because I think that sort of conversation has now become more normalized. It's less of a stigma. What are the issues in male rhinoplasty? Well, for example, trauma, injuries, sporting problems may have caused a problem with weakening the frame, deviating or causing a drooping nose. And for this gentleman who had a problem with both of those, that he couldn't breathe and his tip was drooping and he didn't like the appearance of those traumas, he was seeking a correction which had both an aesthetic and a functional element. We can see here the tip of his nose is dependent. He has a functional problem with breathing. For these sort of operations where we've had histories of trauma, sometimes we take a three-dimensional CT scan. This allows us to model the nasal airway. We can detail the areas of restriction, and it's very helpful in terms of planning for surgery. And here you'll see a picture of on table for the preoperative here, where the new profile beneath, the tip in a better position, and functionally a better nose. Talking about the recovery, I'm often asked about how am I going to recover? This is day 6 after his surgery. So he's just had the plaster taken off and the little silicone splints from inside removed. But you can see with the modern technology of Piezo and the preservation type approach to rhinoplasty, most patients look very presentable, sometimes 7 days, but certainly by 10 days after surgery. Here's this result, pre-surgery, 1 year later. You'll notice changes in the early days after an operation. And whilst you may see a slightly puffy or swollen nose in the early days, as you progress down the healing journey, the refinement improves. Now this is interesting here because this is this is his 1 year, and this image is the simulation, the morph. And you can see we can get pretty close to the morph. In fact, I think his actual outcome is better than the morph itself. Morphing's important because it's a very important communication tool. A lot of patients say, what am I going to look like? I want to still look the same. Well, by using this clever technology, which we can do in front of each other, so face to face, we use a current picture and we can, in a three-dimensional way, alter and change that to give them that confidence that we're not going to produce something that will be unnatural or doesn't suit them.